us right now, we are still in the earlier phase of the surge. While we have been planning for about 5 to 6 weeks now, it has really been that right now we've decreased all of the elective cases of surgery from the hospital. We've reduced our staffing, or rather our patient load, to about probably 60% of the bed capacity. And right now we are just simply adding new ICU beds, shifting different areas within the organization from acute care, non-ICU, to ensure that we can actually support the uptick of expected patients who may require that. For our staff, because of the complexity of our health system, we are unable to hire temporary staff to come in and train with us. So we've actually really continued to look at our relief staff and have increased their hours. We've looked at, because we've decreased our census within the organization, we've consolidated a few different shifts and have been able to reallocate those staff members to train, cross-train in different areas. We're also looking at our pharmacy residents and looking at how they can be a part of the surge. While we are very respectful of their staffing and their rotation time, right now we're actually looking at them to assist us with providing some overnight support. For our residents, they always provide at least 2 weeks, 80 hours worth of frontline staffing at the end of their capstone. And so what we're looking now is actually to schedule them to do some of that frontline staffing and doing that during the time of the COVID surge. For our pharmacy technicians, there's a lot of thought right now into how we train them in wearing PPE and ensuring the organization just adopted mask on for healthcare workers that are within 6 feet of patient care. And so up to now, we've really tried to limit and really be good stewards of the PPE. But at least with continuing expansion of supplies that come in, we're a little bit further ahead now to allow and expand the use of PPE. We have bins that need to be wiped down after they come back, just to ensure that they're clean. We do have two sections. One is a clean bin area, and one is a dirty bin area. So that while we want every staff member to wipe down after they use the tools or supplies, if they are unable to, there at least is a layout area so that we know that it's dirty. So especially with using Omnicell, anytime we go to a delivery, we have a physical contact with the fingerprint scanner, and so do our nursing colleagues. And so that's where we've partnered with them, so that everyone who does touch a Omnicell machine, there is a standard to at least wipe down and use hand hygiene afterwards. We're adding anywhere between 200 to 300 beds within the organization. Right now, we're actually having to get real creative, and so we've taken at least reallocation of any of the Omnicell machines where we've been able to take them out of the intermittent storage as we transition different units. Just today, we actually looked at one of our OR pharmacies and looking at the ORs that are down there and trying to consolidate so that, if there are certain OR locations, access points, we're looking at right now to just really consolidate a few Omnicell machines so that we can actually reallocate some of the other stations. And then also right now we are projecting out that there will be at least 3, future units that will house probably an additional 40 to 50 beds. Those are our really last backup locations. And so with that, we've identified today that, we may not actually have enough Omnicell capacity to meet those needs. So we are reallocating right now, and we'll be kind of, finding how we can actually work with Omnicell. I know Omnicell has some expedited procedures in place in order to deploy some of those assets, and so we're looking forward to that discussion.